Hello, Jay Wilkins here, naturopath and nitric oxide enthusiast and nitric oxide supplement formulator. I wanted to talk to you today about a really great story that we had come in and set up the stage for a nice discussion. Of course, we're all about arginine and nitric oxide, so you'll be about that. But in particular, I'm going to address this story that comes in, and then we're going to talk about some really cool stuff that arginine and nitric oxide does. So this comes from Sue, and she says, "We were first recommended M3 Miracle Molecule Max by an alternative herbalist. My husband's heart rate 2 years after double bypass surgery was irregular and had missing beats. They'd left a blockage to be treated non-surgically. In 5 months, the missed beats were not seen on tests. He's about 80% where he should be. I started taking for poor circulation and restless legs. I also have vertigo. After 5 months, my circulation and vertigo are improving. Would you maybe do a video or post on additional benefits of M3? It has been incredible in helping my circulation." Well, thank you, Sue, for this really great testimonial. Of course, we can't make any guarantees as to what our products will do for people. And certainly, if you have a medical condition, we encourage you to seek medical attention. But we get a lot of really great stories like this one from Sue as to what people are experiencing. So the topic for our discussion is today, what besides circulation, just as Sue wants to know, does arginine and nitric oxide help with? So we're going to consider a few things, and it really helps from head to toe, and we're going to explain why. Again, there's some 100,000 different research studies. I think Nitric Oxide Society mentions 140,000 studies to date on nitric oxide. So it's a very important molecule definitely for helping for circulation, but let's talk about some of those other things. I'm going to bring up some information here that will help me, sort of my notes. So we'll start from the top. When it comes to the brain, and we can add mood to that, because nitric oxide is actually a precursor to neurotransmitters. So your serotonin, dopamine, acetylcholine, all of these very important neurotransmitters, serotonin, that help us to be happy, are produced in the brain, and nitric oxide is very important in helping the body to create those. It also helps your body to make important hormones. So it's a precursor to also your estrogens, your testosterones, those type of things as well. So when it comes to mood, we've had some really excellent response back by people who are saying that it's helped their mood tremendously. They're not near as depressed. They're not near the issues that they had before. So it does help for also when it comes to the brain. It helps for memory. And I think that really goes back to circulation, though. By increasing blood flow up into the brain, then you're also going to have a really good response as far as mental fog and memory and those types of issues as well. So excellent for brain and for mood. Also, the eyes are helped by nitric oxide. And again, arginine, when we talk about nitric oxide, arginine is a precursor. So to make nitric oxide, your body uses arginine that your body makes, as well as what you get from your diet, from protein sources. But we've had also some really great responses, and the science all backs it up, that those little tiny capillaries can get sticky, especially if there's issues with diabetes or those type of things. And so those little blood vessels can get narrowed and clogged. And so by opening up those little blood vessels, and that's what I was seeing in practice, is that 80% of the people that were coming to my office, especially if they're 40 years old and older, they had circulatory issues whether they recognized it or not. And let's face it, all your glands and organs are going to work better if you have good circulation going into it. So there's also really nice research to show that things like glaucoma can respond to, or that's pressure in the eye, can really respond well to the relaxing of those blood vessels, relaxing of even the eye itself, and so that pressure can respond in a good way. So eye health can respond to nitric oxide. We also talk about, when it comes to nitric oxide, your immune system. So what is it that your immune system uses to be able to defend itself against invaders? And the invaders would be pathogens and microbes like viruses, bacteria, parasites, even cancer cells, those type of things, which all of us make. So the way that your body does that is through white blood cells, T cells, B cells, natural killer cells, macrophage cells as well. And all of these things are fueled by nitric oxide, and they use nitric oxide really to disable those different microbes. And so your immune system also works efficiently when there's a proper amount of nitric oxide. So immunity is very important, and a lot of really great research again on immune system types of conditions, and nitric oxide helping out with that, and arginine. Of course, circulation anywhere in your body, as mentioned before, if there's circulatory issues, and sometimes those glands and organs are just not getting proper blood flow, and so by improving nitric oxide, getting blood into those areas, there can be a really great response in so many issues. And circulation is the number one problem. We know this because the number one cause of death is heart attack, and that's fueled by circulation into the heart. And strokes also play a factor when those blood vessels in the neck and the brain become compromised. That's when an individual can have a stroke. So your number one in strokes, I know it's been as much as a number 3 killer in this country at times. And so both of those very much involved with circulation. So nitric oxide, the key, keeping those blood vessels open. Lungs. A lot of individuals that have lung issues, asthma, those type of difficulty breathing, a lot of times it's because, again, those bronchioles, they do not relax properly and they don't fill up with oxygen the way that they need to. And so nitric oxide signals also those lungs to relax. They can fill up with air better. Plus, nitric oxide itself, 1 part nitrogen, 1 part oxygen. So just by oxygenating the blood better can make a big difference as far as overall lung health. Again, studies all support this. Blood pressure, that's really a circulation issue, but basically those arteries become narrowed, and nitric oxide then helps to relax the blood vessel and allow for more blood flow. Liver. The liver also is something that is affected in a positive way by arginine and nitric oxide. Even things like fatty liver or overall liver function, it's been shown to improve by increasing arginine and nitric oxide. Pancreas and blood sugar. So a precursor to making insulin, your body uses arginine to create the insulin necessary to balance those blood sugar levels. Also, research has shown that nitric oxide can be helpful in making your cells more sensitive to insulin that your body makes, which allows sugars to be delivered into the cell and not stay circulating in the blood supply. Kidneys, bladder, urinary system, we can add prostate into that. Those have also seen nice benefits. Again, a lot of it has to do with the relaxing. So there's been research to show things like cystitis, where there's irritation and inflammation in the bladder, prostatitis, inflammation, constriction, by, again, helping to relax things, allowing good blood flow. There's been improvements in those types of things. And then kidneys, it's been shown that ammonia can store up in the kidneys, and that's not a good thing. You really need to excrete that. But arginine and nitric oxide has facilitated the release of toxins and ammonia out of the kidneys. Then the intestines. So for your bowels to move properly, you need to have nitric oxide. This is really a part of a really nice quote from Dr. Stamler, who does a ton of nitric oxide research, and that's one of the things he brought out is basically nitric oxide is important for every function of the body, including the way that our intestines move. So very important. So if people are having issues with constipation, it could be that they're not making enough nitric oxide. Sexual function, one of the biggest problems, again, this is seen as people get older. So we mentioned one thing that arginine and nitric oxide does. It helps to create good hormone balance. So testosterone, all the sex hormones can get out of balance, and this is a precursor to those, and so it can be helpful in that way. But primarily, the main reason that people have any sort of sexual dysfunction is, and this goes for men and women, is a lack of circulation into those sexually sensitive parts of the body. And so when there's not good circulation there, then things just don't work. So this goes back even to the early research on nitric oxide, and the first medication that was developed from this research was the little blue pill, and Pfizer created that, and so that is Viagra, of course. And so that is actually very important for proper sexual function, is to make sure that there is good circulation, good nitric oxide. Muscles, lean muscles, and athletic stamina and endurance and function. Also, nitric oxide and arginine has been very important for this. One of the things that arginine does, it's a precursor to HGH, your human growth hormone. And this is very important for recovery. It's very important to get good HGH levels right before you go to bed to give you a good restorative sleep. And so arginine is one of those things that's used by the pituitary to create HGH. And so by upping your arginine levels, getting them to the right levels, can help your body to create more HGH. Very important for lean muscle mass as well. But the other thing is, by creating nitric oxide, people notice they do this before they work out. They have better stamina, better focus, better endurance. They don't hit the wall that they speak of. A lot of times they can just keep going. And they also, this helps for muscle breakdown. That's the pain that people feel after a workout. The pain and inflammation after a workout is those muscles tearing down and rebuilding. And so arginine and nitric oxide is very helpful in your body to restore that function, that muscle function, and not have as much of those symptoms. But many people notice they take some 20 minutes before they work out, they take some more after they work out, and they have a much better recovery time. What else do we have? Inflammation. This was very interesting to me, that people that I was recommending arginine type therapy, they would get started. They had all sorts of good results, but one of the things they noticed is that they didn't need even sometimes very high-powered pain medication. They said, is there a correlation? So I did the research, and sure enough, there is a correlation. And one of the most high-powered pain medicines out there is morphine. And if you've been in a situation where you've been in pain and needed morphine and used it, you see how powerful it is. But again, the reason morphine works chemically is because it produces nitric oxide at the nerve level, down to nerve endings, and people then don't have the symptoms of pain. So this works in a natural way to boost your own precursors to morphine, or to help with those pain sensations, as well as inflammatory type issues as well. It's been shown to actually help to squelch inflammation in the muscles and joints and all over your body, which some people don't even realize they have inflammation. It's been called the silent killer. So anything that you can do to help bring inflammation down your body is a good thing, and nitric oxide is one of those things. And finally, bones. Bone health also responds nicely to increased arginine, as well as vitamin D. Those work very well together. And so at least 5,000 IUs of vitamin D has been shown to be important just for healthy individuals. More if necessary. Doctors even prescribe 50,000 IUs when they see low levels of vitamin D. But as we know, your body uses vitamin D for calcium metabolism to get into the bones, and then also to get calcium where it doesn't need to be out. Like you don't need it in your arteries, you don't need it stored in your body outside of the bones, but it really needs to be in the bone tissue. And so it's helpful for reversing those places where bone and calcium is getting where it doesn't need to be. But arginine too has its research with regards to supporting bone. I even had some bone loss at one time, and I got my arginine levels up to at least 10,000 milligrams a day. I got my vitamin D up to at least 10,000 IU's per day, and I went back and had a bone scan again, and my bones were healthy. So that was my own story with it. So I been a believer ever since, for sure. So Sue, we really appreciate the question with regards to what else does arginine and nitric oxide do besides just helping your circulation. I hope this answers your question. This is just a sample. Really, there's so much more. I encourage you, if you want to see actually a list of research things that arginine and nitric oxide has helped with, you can go to my info site, which is Bionox, Bionox, USA.info. And on the home page there's actually a little tab that you can push that says arginine and nitric oxide studies. And I think there's over 118 studies that are listed there, and all the different things that has been proven to help with. So this is just general information, so you can go see what the research says, some of it. If you Google search it yourself and put in the condition that you might be interested in, you'll see a whole host of different studies that are out there, and rightly so. People should be interested in what it can do because it does so many things. But I appreciate you giving me your time today. I hope you found this interesting, and we will catch you next time.